All right, well, welcome back, everyone. We're going to start as promptly as we can. And what I want to do is, we've talked a little bit about hairline design, the local anesthesias that's necessary, harvesting the grafts. Now, this part to me is really a large expression of our artistry as physicians and surgeons in designing the pattern that is going to ultimately dictate where the grafts are going to be. So this is known as recipient sites. We're going to go over this, and we're going to talk, first of all, is an overview of the types of recipient sites that are out there. And really a huge component is also understanding how hair grows. And that's going to be how you as an artistic surgeon is able to actually create beautiful patterns that replicate nature. And then a sequence of just basically how to do it. So we're going to talk about types. There's really, to understand this, the timing is one thing. If you're going to make all the sites at one time, that's called pre-made sites. What are the pluses and minuses? Stick in place, which is to make a site and put a graft in. And then we're going to talk about different types of angles, and we're going to talk about different types of sizes or instruments to make sites. So what is better, pre-made or stick in place? And that's a debate that can probably go on forever. The pre-made sites, if you make all your sites at one time, you can see your pattern design very well. But sometimes if you don't have the perfect graft calculation on the front end, you may not have a perfect match, in which case you may have more than you need or less than you need. But the point is, hopefully you'll be pretty close to that number. And I personally like to make pre-made sites so I can see my pattern. And then at the end, come back and do stick in place for areas that you have a few extra grafts or an area that needs to be feathered and blended. And so what are the advantages if people just use stick in place? Well, one thing is possibly having smaller sites, because if you make all the pre-made sites and you wait an hour or 2 or 3 hours, the sites need to be larger because they shrink a little bit over time. And if the assistants are doing mainly the stick in place work, then the surgeon has less time, but that means a surgeon may not be able to dictate the pattern design. If the surgeon is doing the stick in place, the time could be much longer, because then he has to wait for the site to be made and then the graft to be placed. I think for me, what I found, and we're going to talk about here, is going to be the beauty of a pre-made pattern followed by stick in place to feather in the areas that need to be done. This is just an example of some of my work with the pre-made sites. You can see these are already designed and no grafts are placed yet, but the site design has been already made. This is just an idea of stick in place, which is someone making a site and then the assistant placing right after that. So stick in place. There are two types of angles, whether to make the sites sagittally, which is going this way vis-a-vis the head, or coronally going this way. And what are the advantages of each one? Sagittal-based sites possibly have less hair transection because you're following along the natural hair pattern. And the negative of a sagittal site is that potentially you have less angle control. In other words, when you put a graft in, your fear is that it looks too perpendicular, which can look unnatural. You want your hairs to be low, but you're worried that it's going to slide up. Whereas on a lateral base site, this is not my work, I got it from the internet, is there may be more angle control because it's not going to come up as much. But especially for someone beginning, it can be potentially difficult not to transect previous grafts or hairs if you are not very cognizant of how that blade goes in or that knife goes in. Instruments, I tend to use bent needles, and we're going to demonstrate that. You can also use what's called solid wires, and then larger instruments to accommodate perhaps more than one follicular unit. And a follicular unit, if that hasn't been clear, is that hairs don't grow in just one hairs. They grow in clusters of 1s, 2s, 3s, and 4s, and you'll start to see that develop as we go into the workshop. And this is to accommodate potentially a couple follicular units or 3 follicular units. These are just examples of follicular unit instruments, the solid wires on top, and these are just standard bent needles that you see below there. It's an 18 and a 19 gauge needle that's bent that can also be used for site creation. If anything you forget, if you remember anything from this talk, I want you to start to see how hair grows. It's so important that when you're doing this that you understand and recognize natural hair patterns so you can recreate it. This is from Dr. Ron Shapiro's, one of his articles, and it just shows you that hairs grow in different angles in different places. The central area here, they all grow pretty straightforward, except just at that lateral centimeter where you're going into the temple-based hair, where it starts to curve and almost cascade and fall down, so going like this and then further and further down. And we're going to show you some of those sites in the workshop so that becomes clearer for you. The crown is a very difficult area to understand. It's an advanced area. I highly recommend not starting the crown for probably maybe in a few years until you start seeing your work come back to you, because remember, your work takes a year to two before you start seeing it come back, and you want to make sure you're doing the right thing. The crown has certain different patterns. This is from Ziering's work, and you can see that the key with this is that it's not a straight pattern, it's a circle or a whorl. And that's really, really important to understand that. When we're making recipient sites, the two big things we want to talk about are angle and direction. Angle refers vis-a-vis to how much tilt up and down from an AP direction this way your site is being made. And the direction has a relationship going this side to side. So when we talk about angle and direction, those are very important ideas to understand when you're making sites. I like this little idea of a box. I came up with this trying to help think about how we can not put hair on the forehead or transplant things that don't make sense and understand pattern. I think of it like a box, because there's a horizontal component to the scalp, there's a vertical component. In the front, vertical component is the forehead. The hairline is at that shingle point we talked about, where it transitions up into the flat plane, and then as it transitions back into the vertical plane, we heard from Dr. Parsley that that's called a vertex transition zone, and that's like a posterior hairline, if you will. The side hairlines, you also heard from a hairline design element, is where the side canthus is, and that goes up like this, and that's where the hairline ends and where the temple hair starts to come down. And Dr. Elliott's actually going to show this. We had some concerns that that we need to go take a step back and do some anatomy discussions, which we're going to cover around 12:30 today. So those are just some ideas of temple hair or lateral parietal hump hair, the central frontal mid-scalp hair, as well as the crown hairs. And if you think of this box model, I think it's quite helpful. So this is just an actual human person. You can see sort of the central forelock here, mid-scalp region behind it, the temple humps on the sides. And again, this all become clear during the actual workshop portion. The bridge going back toward, or the vertex transition zone going back toward the vertex, and then the zone of 3 or 4 centimeter hairline in the front. These are just a artist rendition, and there's some X marks, I'm sorry. This is actually for a book that I'm working on, and you can see that there's angles that are different. And the key, if you remember everything, is that go low with almost all your angles. If the angles are too high, things can look grafty because you can see the insertion points, and it doesn't create visual density. We're going to talk about that more specifically. These are just ideas of keeping angles low, very low, especially toward the front hairline. In the crown area, I tend to go a little higher to create a lift, so it actually, but that's a very advanced topic. I just want you to remember, if you remember anything, is to go lower than you think you need to go. And that's going to be very, very important, especially toward the hairline. So how do you do this? Well, you heard tumescence is so vital, and it's so vital because it protects the underlying vascularity and allows you to have a safe recipient site creation. Unlike the donor area where you want to tumesce everything on the front end, when you're doing the recipient site tumescence, the key with this is to go sequentially, because you're going to spend longer time to make sites than you would to harvest it. So I will put maybe about 10 cc's of recipient tumescence or 20 cc's into the area I'm going to work for some of the epinephrine and Kenalog to take its effect. But then I'm going to sequentially, if I'm going to work toward the central forelock first, I'll put added tumescence there. As that diminishes, as I work toward the hairline, I'll put a little bit more there and reinforce that. This idea that I give credit to Dr. Elliott coming up with, which is the idea that a ship is riding high over the coral plain, is that the corals are your nerves, your blood supply, and if you put a lot of water between the two, your needles and blades don't hurt the coral, and that's a good way to think about it. So you always want to be working at high tide, not low tide. The idea is having the patient's position well. In our 3D demonstration, I'm going to reinforce this idea. When you're working on the hairline, if the patient's sitting and you're working like this, it's very hard to get your angles low enough on the front hairline. But if they're lying back like this and you're sitting, if you think about it, you're going to make your angles very low vis-a-vis the scalp because they're in a supine position. So I find it very easy to have the patient fully recumbent for the hairline work, and my sitting down and working this way so I can make sure my angles are low, because natural hairlines are low with the angles, not straight up and perpendicular. And again, always thinking about making sure that your pattern design is natural, and so that you can think about how hair grows in the hairline, how it grows in the mid-scalp region, how it grows in the temple, how it grows in the crown, and look at people that have hair, and especially if they have closely shorn hair. It's a great way for you to really reinforce your knowledge of understanding how hair grows before you start your first transplant.